I've struggled with this my whole life. It just made me so insecure. It's life-changing. Thank you, Dr. Lebowitz.
This is Dr. Jonathan Lebowitz, plastic surgeon in Huntington, Long Island, New York, and I'm doing lip injections. This is one of my specialty I do, besides male breast reduction gynecomastia surgery. This is my second most popular, and I'm really good at this. I do the Blunt Cannula Technique. I enter through these little edges by the skin because the skin is less pink, less nerves, and less blood vessels than the pink portion. You put a needle in this, 9 times out of 10, you're gonna get a bruise. So I do the Blunt Cannula Technique. I'll show you that in a minute. I've got videos in that. We're gonna use Juvederm Volift. They actually just changed its name to Vollure, but it's the middle of the road, long-acting, second-generation Juvederm products. There's Volbella, Vollure, and then Voluma. And she's a newbie at this, first time doing it, and I'm glad she's doing the middle of the road one because she's gonna get perfect, long-lasting lips. It lasts over a year, and she's gonna be thrilled with the results. Well, if you go a little lower, it looks good for a month or two, and then they kind of get used to it, and they say, oh, I wish I went bigger. And so she's doing the middle of the road, which is great. And maybe the next time she'll go wow with the Voluma. But we're going to do Volift. So the first thing I'm going to do is prepare for my Blunt Cannula Technique. We give a little Novocaine, open up just a tiny bit, just right over here, right there. We do in the skin, again, because it's got less nerves and less blood vessels. So a little bit over here. It's an insulin syringe. Boom. Good? Mm-hmm. Mom is watching. She's not on camera, but she's watching. Mm-hmm. And a little bit over here. Okay. And we're going to let you sit. Open up just a little bit. So right in that little pilot bump. Now you can kind of see it go very gently. The way patients come back is if you don't hurt them. So you go way up here, I'm so sorry. So I'm right. Let me just make sure I'm right where I want to be. Sorry about that. There we are. So that I'm right there by the Cupid's bow. And let's start to inject. It's got lidocaine in it. Bring it on out. Good. She wants a little bit of fullness. Now go back in. You all right? Mm-hmm. Good. There we are. You can kind of see where the cannula is. Go back up here. Magnifico. Come flat out there. 1, 2, 3. Good. Make sure I'm got my. Come over here. Come a little bit. There we go. Cross the midline a little bit and come out. And that's it on that side. Okay, there I am. Give a little squirt of the stuff. Get the Novocaine in there. Beautiful. Feel where that is. Go back again. There we are. There we are. Cross the midline just a little bit right there. Sorry. So I'm going to 4. I'm going to 4. You all right? Mm-hmm. Perfect. One more time. You can kind of see there I am. Right there. Right at that Cupid's bow. And we're just about there. Perfect. There we are. Go the lower one. Stretch it out. There we are. There we are. There we are, right there. See the tip? And You all right?
Mm-hmm.
There we are. Now it's interesting. Her lower lip has that little like tushy shape to it. She's got that little, which is I think very sexy. She's got that little butt crack, what's it called? A butt crack. She's got that tushy shape where it's thicker, and she's got that line, which I think is very sexy. And you don't want to change who she is. Bring it out a little bit. Good. Come in one more time. Change up the direction of it right there. Come on now for a second. Make sure they're even. And nice. Got a teeny bit left. See that little crease? I think that's great. So I maintained her. She's got that little, and one person actually wanted me to put a string there. So this little tushy thing, that is actually,
Pretty.
she looks pretty. That actually I think is very sexy and very lovely. I don't want to change it. Yeah.
This looks more natural too.
It looks more natural. Rather have like a sausage lower lip. I like that little, hot, that little, tushy looking, deficit in there. I kind of like that. Now, it's numb. So you're not feeling it. You're not moving it. It's numb. So like in a Novocaine, so you feel, but I think it looks amazing. It's a little swollen, like any trauma. You got a little bit, but look how gorgeous it is.